Now, welcome back from that short commercial break. My name is T.JAKIRA, and you are watching HealthPort. I'm sitting in for Edrin Austin Mukarazi, and HealthPort is brought to you by Makerere University School of Public Health and Church of Uganda Family TV. And now in studio, I have Dr. LYDIA PAPALO, and we've been talking about childhood obesity. And I believe that she has more to expound on the physical complications that come in when it comes to obesity.
Yeah, so as we had alluded earlier on, some of the complications, we have what we call hypertension. Hypertension basically means a high blood pressure. So when people are obese, it increases the risk of hypertension, because in hypertension, we basically look at what we call a systolic blood pressure and a diastolic. So with obesity, this increases. It causes a rise in the systolic and diastolic blood pressure, so which results into the hypertension. Then we have other complications, what we call gout. This happens more in the male. And then we have what we call arthritis, which basically means a joint swelling when you have a deposition in these joints. And then the physical inactivity. You find that people who are obese, they're less likely to be engaged in exercise, so they are unfit, so which is not good for their health. Then we have other complications. We have what we call fatty liver, non-alcoholic fatty liver. Means that the excess fat ends up being deposited in the liver, so which interferes with the whole metabolism of the person. So that could be, which is not good for their health. Yeah.
So I've heard about cases of people getting, is it asthma? Does it also come because of obesity?
So asthma per se is not as a result of obesity, but obesity predisposes us to other things. You find that still, because what we call fat embolism, what happens, you find that this fat dislodges from your body and goes to the lungs. So this can cause a difficulty in breathing. Yeah, asthma as per se is more of an allergic condition as vis-a-vis an obesity related.
Okay.
Yeah. Condition.
So we can't say that anyone can get such a condition because of obesity.
You know, asthma is basically an allergic condition.
Thank you so much for expounding on these things. So I just wanted you to talk to us about what is Uganda's condition, what is Uganda's situation when it comes to obesity?
Yeah, maybe the most recent thing we've heard about obesity, we know obesity was more of a condition for the affluent communities and well-developed countries as opposed to the lower and middle-income countries, which Uganda is part of. But one of the studies which was picked from Uganda Demographic Health Survey of 2016, which showed about 5% obesity in children, as opposed to other countries like US, you find that the prevalence of obesity is about 22%, and yeah. So obesity has not been a common thing, but we have noticed this change during the COVID pandemic, because pre-COVID era, you find that the children were active, they were playing with their colleagues, they were always going to school, but you realize that when we had the COVID pandemic, mostly children were indoors. You find that the families, especially like in Kampala, you find that children were most locked in their houses because of the fear of the COVID spread. So you realize that these children are inactive, but they're feeding a lot. So you find that all these foods they're consuming just gets converted into fat. So that increases the prevalence of obesity. Though we have no clear studies we've done so far to ascertain the prevalence of obesity, but we've generally seen an increase in the number of children who are obese during this COVID pandemic.
Okay, thank you so much for that. I just wanted us to get into how to prevent obesity, even at an early age.
Yeah, so we had said that one of the risk factors for obesity was maternal obesity. You find that when the mother is obese, there is a higher risk of of giving birth to a child who is big, overweight. Yeah. So if maternal obesity is reduced, so we have a lesser chance of producing kids who are at risk of obesity.
Yeah.
And then
we have a challenge where mothers always want to eat for two. That is what I've always heard, that you're not alone, you have to eat a very big portion of food. What is your view about that?
Yeah, because one thing is we realize that, yeah, we're eating for that too, fine. But also we need to moderate what we are feeding on. So
Yes.
if you're feeding more on the carbohydrates and you're not balancing the diet, that will have an overall impact on the baby. So if maternal obesity is reduced, yeah, and then we have a higher chance of delivering children who are normal weight and reducing the chances of obesity. Then the other...
I just wanted us to expound on this, because I believe there are many mothers that are watching and are probably pregnant or preparing to be pregnant and all that. What are other things mothers can do to...
So the mothers, we encourage, one thing is a physical activity. You find that mothers, when they're already pregnant, some become lazy, they do not want to do anything. But we encourage you to be active, do the home chores, and move around. Yeah, so that to increase on your metabolism. Otherwise, if you just eat and sleep, so all this food is converted into fat, which is not good for your health and the child. Otherwise, if you're going to be obese, you have a big child, so that will increase incidence of things like cesarean section. You find that this mother is unable to push this baby, so she ends up with a cesarean section as opposed to the normal vaginal delivery.
I would like to believe that also they have to restrain themselves from eating junk.
True. We encourage more of the natural foods as opposed to the junk, because of the cholesterol amount in these foods, yeah, which is not healthy otherwise.
Yes, to eat more fruits,
more
vegetables.
green vegetables as opposed to the junk.
Okay. Yes, I'm glad that we are sharing about these things, because I believe that many mothers are taking part of this conversation. So what are other preventive?
So other preventive things, also still on the maternal and child, because one thing, the other risk factor I did not mention was prematurity. Babies who are born premature, they have an increased risk of being obese in future.
Yes.
Yeah, because you find that now there has to be a compensation later. Yeah, as opposed to, because premature basically means children who are born less than 37 complicated gestational weeks.
Yes.
So you find that these children are small. We're trying to feed them, so that increases their rates of being obese. But we have, so basically what we have to do is we reduce the chances of delivering prematures. Then we can also reduce the risk of obesity in these young ones.
Oh, yes.
Yes.
I had never seen that as a cause. Actually, though, I usually see some children who are too big and they look really obese.
Yeah, true, because the prematures, they're born a bit earlier, but the body compensates as they grow. So this increases the risk of obesity. Actually, realize that the number of prematures who are surviving are increasing in this country, as opposed to previously, where when the health standards were a bit lower, but the standards of health are improving, so we have there's an increased survival for these children who are prematures. So at the end of the day, we're going to have increased risk of children who are becoming obese as a result of prematurity. So as a country, we have to see ways of how to reduce prematurity. Yes.
Yes, so as we conclude, I just want to know what do you feel like you have left out about the preventive measures?
Of course, the physical fitness, which we had not, exercise is key, not only the pregnancy, as we had emphasized, even the children. You realize now with the current education system, children are going to school early, they are mostly seated and having less of physical activity. Yeah, they are picked with vans from their homes, and they reach school, and then they sit the whole day. They don't have time for physical activity, so that will increase the risk obesity. And then the feeding programs.
Yes.
Back at school and homes, we encourage parents to feed their children on healthy diets. You find that the affluent schools are the schools which have more of obesity as to our rural community schools. So if schools can improve on their feeding programs, so that will promote healthy children and a healthy Uganda.
Okay.
At wide, yeah.
Thank you so much for being with us today and for sharing your wisdom with us. I'm sure that many mothers have learned a lot. Many parents have actually learned a lot. This doesn't only affect children, it also affects adults. You've been watching HealthPod, and my name is Brenda Jakira. HealthPod is brought to you by Makerere School of Public Health and Church of Uganda Family TV. Now, if you're watching on our YouTube channel, I encourage you to like this video and share your feedback with us. Thank you so much for watching HealthPod. I sign out.